My name's Professor Sarah MacKenzie-Ross. I'm a clinical psychologist by training, and I specialise in neurological conditions and diseases, and I specialise in toxicology in particular. Neurotoxic syndrome is a term that was actually coined in the 1990s by a couple of toxicologists to describe symptoms of ill health that cabin crew and pilots were reporting, which they believe has arisen due to breathing in contaminated air on the aircraft. I was contacted by a health and safety person from a pilot union who told me that there was an issue amongst aircrew and pilots, and they believed that the chemical that was particularly likely to be responsible was organophosphates. And they had found my name out because I was already researching the toxicity of organophosphates and had been for several years. So my work basically involved seeing airline pilots and assessing them. They reported symptoms of what we'd call acute ill health when they experienced on an aircraft contaminated air. So those acute symptoms would be things like ear, nose, throat irritation, feeling sick, respiratory, breathing difficulties. They felt that these symptoms often resolved when they got off the aircraft, and then maybe were triggered again if they got back on to aircraft. Some of them then explained that if they kept experiencing toxic air, that over time their symptoms would take longer and longer to go away until they ended up with a kind of permanent ill health. We then put them through a battery of neuropsychological testing and found that they did show evidence of cognitive impairment. And some of the pilots did report quite alarming problems when they were flying, like forgetting information from air traffic control, or getting the information, the numerical information, the wrong way around, or even forgetting whether they'd lowered or raised the undercarriage. One of the pilots that I interviewed had been involved in a very major, near catastrophic accident where they had to do an emergency landing because both pilots were affected. It was just that one pilot was unconscious at one point, and the other pilot managed to not lose consciousness and went on oxygen, and so was able to complete the emergency landing. But they were both ill, which is really scary. Most airline pilots are very passionate about their job. They've spent a fortune training to become a pilot. They love it. They don't, want to give it up. And so when they were unwell, they'd be pleading with me, is there any treatment? What can I do? How can I get better? How can I go back to work? And it was difficult to have to explain to them that we just simply don't know. There's no what we call follow-up studies. So yes, I've seen a group of people, once or twice per person, and I can see what's wrong with them in the moment, but I don't know what happens to them over time. Do they get better? Do they get worse? Do they stay the same? I was trained in the health service. You're not supposed to recommend treatments that haven't been proven to work. And so these people were quite often going off and spending large amounts of money with private practitioners because there's nothing else out there for them. What we need is clarity, but that's not going to happen if people aren't going to recognise the condition in the first place. What I really hoped was that we could get funding from somewhere to do a proper large-scale epidemiological study. There needs to be some willingness from bodies that would normally fund research, whether that's government departments. So, most countries have some sort of Department of Transport or some kind of aviation authority. Then there's the airlines themselves who could potentially fund. So I guess there are several groups of people who would need to have a willingness to hand over money to fund the research. Now, they tend to argue that the few studies that have been done are sufficient to suggest that neurotoxic syndrome is not caused by contaminated air. But these are very small studies, and all of these studies have pros and cons. And I've always wondered why, if they're so convinced there's nothing in it, you don't fund the one large-scale piece of research to prove your point. Why don't you fund it and put this whole issue to bed? We need to do the proper research to find these things out.